He stared at me, confused, dazed, didn't know where he was. He could not move, could not speak. Everything was happening so fast for him. I held his head and assured him that everything was going to be okay. Then I assessed to go over to his wound. His leg was bleeding, and I covered it up. I held pressure point, made sure no blood was going through, he wasn't losing any blood. And for that 5 minutes, it felt like days for him. This is my passion, saving lives. I'm passionate about my job. I work as a senior officer and a first aid attendant at a security corporation. And mostly our job is to make sure, at least my job personally, is to make sure that the shift is going smooth and there is nothing that is wrong with it. Also, as a first aid responder, my job is to provide first aid care, uh, look at patients, assess patients before sending them off to the hospital and stuff. So I am the first responder before any other emergency services get there. So we have basic first aid training. For my case, I have advanced first aid training, and so it is our job to make sure that the patients are well assessed, and it's not only patients, could be anyone who's having like mental health issues and stuff. We go talk to them, and if we see the patient is not good, then we make sure we take him to the hospital or we transport them to the hospital, or RCMP comes and takes over from there. Um, for my job, we have a lot of training. There are tons of first aid trainings that I had to take to come to the position I'm at right now. I remember when I first started, I was just like the first, like I was not a first aid attendant, I was just a foot patroller. So all I had to do was walk around the area and make sure everything was secured and stuff. But now, since I've been working there for a year and I've taken at least 5 to 6 first aid training courses and physical training, so I'm now a senior officer, which is the shift supervisor. So what we do is for first aid, we first assess patients. We see if their pulse is okay or not, if their breathing is normal or not, and if there's anything wrong with them. Because internally, we can't do anything if they have internal bleeding or something, but if there's something exterior, we respond to it. For example, was one of the incident I was talking about at the beginning of this video. So his name was David Bernardin, and he got hit by a car, and that's when I was the first one on scene since I was the first aid responder that night, and it was one of the biggest incidences I've faced so far. I've had incidences from car crashes to heart attacks to minor cuts and bruises, but that was when it actually tested my abilities as a first aid responder and a senior officer both. So I had to give orders to my other coworkers to how to assess, how to block the roads because it was on a freeway, and then me personally I had to stay with Bernardin, and there's a picture that I would like to show you from that incident because it was on the news. And sorry, this is it. That's the fire department right there. That's me, and that's Bernardin on the ground. So Bernardin was helping us with traffic control, where there was another accident on the other side. And this is basically what my job consists of. So I put on my uniform and I go into work knowing that I might have to risk my life in order to save someone else's. So these are many incidences, one of the many incidences that I've faced, and yeah, my job does take an emotional toll on me at one point. But when you respond to a lot of incidences and you get used to it, and especially if you save someone's life, it feels a lot better than it did at the start. I can tell you that for sure. And there are other major incidences where, since I want to join RCMP, I feel like this job is something I'm good at, and I'm really passionate about because it's gonna help me go through policing or paramedics if I want to in the future. So here's a picture of sometimes when we respond to stuff with RCMP and paramedics, and you can see all the lights up here. The road's been blocked because of the car crash, So this is what I do for a living. I save people if I can, if that's in my power, or I'm just the first responder and the first person to people see when they're in pain or if they need help. And I really feel good about that. It makes me feel important, like I'm a part of something big, and gives my life a little meaning to what it is now. And so it's just me and my colleagues who go out there every day thinking hopefully things are going to be smooth, and if they're not, we know what to do. And here's a picture of us at work, just goofing around a little bit. And yep, these are all the first aid responders, and that's my shift. So it's just us, it's 4 people on the field, making sure that nothing goes wrong. Thank you very much.